So, over the years, and we've done security and life safety and some home automation, but, for decades, we've heard when we're really going to optimize healthcare and really deliver the support, especially with the chronically ill patients that's needed, it's going to have to happen outside of the doctor's four walls and in the home. And so, we've watched these decades and we've never seen anything take root other than you either have like medical home health care for people that are, in a kind of a serious condition or position. And then you have private duty home care. And the reality is that, healthcare is expensive. We're trying to figure out how do we provide more access and extend more care, but how do we do that at scale? Because there aren't enough dollars to go around the way we run things now. And you've got patient populations, like you look at the aging population. We've got, about 48 million of them now. In the next 30 years, it's going to double in size. And they're consuming the majority of the medications out there. They require a lot more care and oversight. When we have things like the coronavirus or a big influenza outbreak, that's the group that's the most vulnerable. And most of them have got one or more chronic illnesses. So they need a lot of support. If you start looking at the size of the population, you get into tens of millions. You can't do that by sending people out. So when we started 10 years ago, we knew that we couldn't afford live care for continuous care inside of the home. And it became evident when we were interviewing hundreds and hundreds of providers that technology by itself is nothing but a doorstop, right? There's got to be a lot of coordination. When we talk about people that need continuous engagement because they're dealing with diabetes or they're fighting cancer and they have diabetes plus cardiovascular disease or just recent stroke victim, they've got neurological disorders or musculoskeletal disorders, and they need a lot of ongoing support and care and oversight and physical therapy. That episodic approach or app on tablet, app on mobile just doesn't work. But when it comes to people with a chronic illness that need more, or a mental health condition that need more, that's where it breaks down. And if you look at the older population and the innovation being created for the older population with declining hearing and vision, slowing down in the mind, increasing memory loss, they're not navigating through menus and getting on 30 minutes on a tech support line, waiting for somebody to tell them how to turn on and off their Bluetooth to collect their vitals device. So when we started looking at this stuff, all right, let's start here. What are the big problems out there? Chronic disease management is the single most costly challenge in the healthcare system. And it happens to be associated with this rapidly growing aging population that's about to deliver a crushing blow to our healthcare system. And we look at the need to monitor and engage somebody more frequently to help them unpack the various tasks associated with their personal care plan, because they really need that help. We started seeing journal after journal that was publishing these studies saying that 50% of all treatment plans around the world, the failures of those treatment plans are a failure to adhere to the treatment plan, right? So, and a lot of that, the majority of it, I think, is not taking their medications on schedule, on time, or they take something, they forget they took it, and then they go back and they take it again, right? You look at 70% of people discharged after a major procedure from a hospital, and they go home and they might be with a spouse, and they start going through the manila folder and all the notes, and they're confused. 70% are confused about what they just went through in review of these documents with the discharge plan. So those are things we want to tackle. We wanted to improve outcomes by tackling adherence, increasing adherence rates, and be able to affordably provide a user-friendly solution in the form of a virtual caregiver that could help manage chronic disease, whether you're fighting cancer, cardiovascular disease, respiratory disease, diabetes, a combination thereof. Be able to personalize and even not just personalized care plan support protocols, but to be able to actually assess the performance of a treatment plan, to be able to demonstrate physical therapy at home, and to be able to verify physical therapy is being done, and then measure the improvement of recovery or the lack thereof. So it became a big vision. We're going to create an interface for medication management, collecting vitals with peripheral devices that's voice, but not just voice like your Alexa. We're going to give an Alexa type character a face and a body in a 3D environment.
Hi there. Nice to see you again. I'm Addison. Welcome to Addison Care. Thank you for inviting me into your home. I look forward to managing your health with you.
We're going to do some computing on the edge. We're going to have some artificial intelligence incorporated, and we're going to provide emergency response and connections for medical professionals that can do instant triage. We're going to do gait and balance and motion analysis. We'll see evidence of an increase of somebody's fall risk, and then we'll be able to help consult and engage and coordinate the members and stakeholders in the care circle, from family to provider to patient. 14 peer-reviewed publications, 20 scientific conference presentations, a first-generation product, a second-generation product we're now using for infectious disease suppression that's Medicare reimbursed as a service. We've now developed the virtual caregiver that does at least 50 times what we originally told those venture capital firms. We've got thousands of patients being monitored 24/7. We've had white papers, we've reduced hospital readmissions, we're signed with major health institutions. We have a national network of care partners across a variety of different care and senior care business models. And we did all of it for $60 million. We raised it all on our own. Not easy. Well, we have two models. So we have a system that provides emergency response, med management, some geolocation, physician on demand at the touch of one button. It's got an emergency risk pendant. It's tied to apps for the care circle on Android and iOS devices, so everybody's always updated. And that device is out there as a end user or patient pay or solution. Now we have home care companies filling the gaps between live caregiver visits that are paying for this. We have senior living parties that operators providing this for all of their residents to maintain occupancy and provide a safer, more managed wellness solution for their residents. We have another solution, which last year CMS issued some codes. And what they do is they reimburse for remote patient monitoring. We come in with a smart health hub powered by AWS and AT&T Wireless, and it's on our infrastructure on AWS. It comes with these peripheral devices, a natural language processing interface, and it's got a little wrist pendant if something escalates to an emergency. And we go in and bring in a healthcare organization who works with that doctor to scrub the list and formulate the order for the doctor's review. And then they partner with the doctor to handle a lot of that 20 minutes a month on the review process. And it makes it really light and easy for the physician. If they want customization to the portal, if they want integration with a custom EHR system, if they want it onboarded with something that's not proprietary, but we do all of that, and we don't charge the doctor for it. We examine their workflow, and we bring this to market, and we help them make sure that this integrates with their practice in a non-disruptive way. And if you look at the home care industry, private duty is the fastest growing segment. but it's $20, $30 an hour to bring somebody in to care for mom or dad. That's a lot of money. And they don't want to roll for less than 4 hours. The average price for 20 hours a week is $2,000 plus a month. Only 3% of North America can afford $2,000 a month. There's another 40% out there that's looking for connected care, a digital health solution that's really got capability. That's never been available. That's the gap that Addison starts to fill. So she's very robust for chronic disease, mental health. She's customized for older adults or child patients. A lot of people don't know 27% of our US child population is living with a chronic illness or a disability. And the pressure on caregivers is tremendous. We have just under 50 million informal caregivers, mostly families. They're not getting paid. They're providing 30 billion hours of support a year. And a lot of those people are employed. Now we've got a lot of pressure, and the US doctors more than anything now really need to start looking at Medicare is here to pay these doctors to protect and monitor at home the most vulnerable segment of the population. If they're not doing that anyway for a group that already needs the extra support to manage their chronic illnesses, because most of them have it, it's irresponsible to not be doing that when the doctor is actually getting paid to do it. But in light of this new disease we've got, I think the pressure's on. I think they have to do it. And I think once they begin doing it and they see that, oh wow, adherence is dramatically elevated. Wow, we've got improved outcomes. Oh, look at this new data like we just got from northern New Mexico. The diabetics readings are now better. We've got indications that they, using the solution, are having an easier time more effectively managing their disease.